Hello, everybody. I'm here to talk to you about a few important things related to human life. I'm Dr. Sudipta Roy. I am a clinical psychologist and I'm working in Surat. I've been practicing for the last 25 years. And one of the regular things that we come across is people who are depressed and people who have suicidal phenomena or ideas in their head. And I'm here to talk to you about how this phenomena happens and how we can help people who might be feeling suicidal and how we can help them to feel better about themselves and get out of this action. So let me start with a few triggering events that is commonly found in people who may consider this drastic action of suicide. One of the things that we commonly see in people who might be feeling suicidal is an experience of loss. This loss can be of several types. One is the loss of a loved one. It might also be a loss of status. It may be the loss of a financial deal, and the person might feel that they are now in a debt. That's this is one of the most traumatizing things for people that drives them to this extreme step. There is also a sense of fear that might be involved in people who have suicidal thoughts. Fear of being discovered, fear of losing status again, or maybe fear of losing something that they have at the current state, in the current position. Another triggering event that we find is that things that surround or evoke a feeling of shame and guilt in people. Like, say, some people are a little unhappy about their bodily appearance. Sometimes they might even have gone through a traumatic, abusive relationship, which may also lead to this feeling of shame. And sometimes committing a mistake which they think is very serious would induce guilt feelings, and that can lead to suicidal attempts as well. One of the very common things also seen is people tend to buckle under pressure. Like, say, supposing a teenager might feel a little bit overwhelmed because of the expectations that parents have from them, which is why a failure to meet those expectations can lead to suicidal thoughts or even taking the extreme step of suicide. Sometimes it also happens that people are in a traumatic situation and they feel trapped and they cannot see a way out of it. Like people who are into experience of domestic violence may also consider such an action. And a little bit on the lower side, but we also see this, that people who are in conflicting situations where there are continuous arguments, continuous fights in relationships and at home, there may be a tendency to take up suicide as an impulsive action. So these are all the triggering events that might lead people or drive them to think about suicide. Now, once we've identified such triggers, the next part of it is to identify how and when the person is actually going through feelings that lead to suicide. The common things that you might see is withdrawal from relationships. You may see that the person loses interest in their activities that they used to enjoy earlier. You may see a lot of negative talk. You may also see negative posts on social media. Sometimes you may find notes like goodbye notes or maybe even suicide notes. And sometimes it's possible for a person to consider suicide without even showing any of these signs. So that becomes quite a challenge, how to discover this and help people who might be in this distressing situation. So coming to the next point then is how can we help people who might be considering suicide? There are a number of ways, fortunately, in which we can help people out of these distressing feelings. One most comforting feeling, most comforting action for people who might be going through this distress is to have somebody who listens to them and cares and shows concern towards them. If you have somebody who shows negative thoughts, feelings, uh, just engaging in a little bit of caring and concern activities with them will help them to come out of this situation more easily. The other thing is that if you will go out of the way to reach out to them and do something for them, that usually helps them to bounce back much faster. One more way to help them is to distract them from those negative thoughts or engage them in some rewarding activities. Um, One of the things that is often seen in social media and on WhatsApp and as well as on internet, you would find a lot of things telling you to count your blessings. Although it seems a little repetitive and cliche, it is a very important thing to do. When we are in a spate or in a storm of negative emotions, if we just step back and realize how much life has given us or what we really have with us at this current moment, we might have so much hope to live for. And the other thing, most importantly, is to be able to seek help. A lot of people do not allow themselves to seek help for the difficulties that they are facing. And as there is a lot of stigma attached to going to a psychologist or a mental health professional, I would urge people to kind of make this a part of your drawing room conversations. Like, allow seeking help to become a part of your life. Encourage people who are in distress to go and discuss their issues with professionals who can actually give them the expertise needed to help them out of their problem. Thank you so much for listening to me.